Our next item, trustees, is our influenza update, 2018 influenza update, and I know Ms. Bacolor will join us. So Dr. Swift, do you want to introduce this?
Thank you so much. I asked Ms. Bacolor to join us this evening, trustees. Ms. Bacolor is our Ann Arbor Public Schools health official. She has been engaged with the CDC and with Washtenaw County and felt compelled based on the data in our Ann Arbor Public Schools. Our attendance rates for January, trustees, demonstrate that our attendance rates in January demonstrate that we're in the midst of a flu influenza impact. And so I appreciate, when we redesigned the Rec and Ed division and made her community officer, she inherited, and what I love about Ms. Bacolor is that she's highly qualified to do this. You notice the MPH after her name on the letter in your packet, but we are issuing to the community, this message will go out tomorrow, a warning and just some awareness tips. We don't want to cause panic, but Ms. Bacolor has some tips to offer that we should all be practicing. And so with that, I'm just so, I'm not pleased that we're having an outbreak, but I am pleased that we have a highly competent professional who will help us know what to do about this. Ms. Bacolor.
Thank you. So I'm going to walk us through several things fairly quickly, and I'm happy to take questions as well. You'll hear me say CDC a lot during this presentation, and that stands for Centers for Disease Control, which is our national public health agency located in Atlanta. And like Dr. Swift said, I do have a Master of Public Health, and I worked in public health for many years before I came to the school district. So the presentation overview, I will start with the national and state picture, and then go into AAPS impact, and then we'll do prevention and additional FAQs and resources. All right, so starting with the national picture, it's kind of funny to put up a map of the United States that is basically all one color, but this shows that we have widespread flu across the entire country. And oftentimes, during flu season, we see flashes of flu in different parts of the country, but this year we are seeing sustained, widespread, and this is our third week across the country. I did want to point out that the U.S. Virgin Islands is only sporadic, and if you need someone to go and make sure that they're doing okay, I volunteer.
I can help with that.
Yes.
If you need.
Okay. Yes, you're an MPH too, right?
Yes.
All right. Only MPHs get to go. All right.
I knew there was a reason I got that degree.
So there is a possibility that the West Coast is coming down a little bit. That's something that was said today by the CDC. But in other areas of the country, it's still rising. So things to know, that almost 80% of the flu nationwide is a type A strain called H3N2, which you might have been hearing in the news. This strain of the flu virus is intrinsically more likely to cause severe disease. It's just the nature of this viral strain. What we're seeing this year across the country is early and more flu doctor visits compared to the last few years. But it's consistent for years when we have H3N2 as the dominant strain. The CDC says we're halfway through the flu season right now. All right, so what's happening in Michigan? In the state of Michigan, I'm going to show you a couple slides that have dates along the bottom, and these are weekly flu surveillance data points. And also you'll see a legend up here for types of flu strain, and don't worry about that too much. The important thing to know is that, like the rest of the country, what we see for January 20th, this big red part of our bar, that is in fact H3N2. You can see that our positive test results have climbed a bit here. But I'd also like you to notice that we also have the B strain of the flu, also in Michigan. And this is the blue represents our old frenemy H1N1 pandemic flu. So I was able to connect with Washtenaw County Health Department today, and they also do weekly flu surveillance. And this is two things on this slide. Again, we have the weeks along the bottom, and then this kind of purpley looking line shows school and childcare respiratory illness rates, and this is reportable, and our school district does this too. We report to the health department every week. And the blue line shows lab-confirmed influenza. And as you can see, starting back here, late November, we started seeing more and more cases, and really the slope has just gotten more upright here as we get into early 2018. The county epidemiologist said she had hoped that maybe we would see some leveling, but we didn't for this past 2 weeks. And as you can see, we've had big jumps in our lab confirmed cases. Those are, 150, 200 case jumps. So how has that impacted the health of people in Washtenaw County? What we can see is that flu-related hospitalizations has also increased. And they've increased the most. Our most highly affected is our 65 and older population. I do want to point out this little light blue down here that represents children 0 to 17, and we had 3 hospitalizations last week in the county. And then in the middle, less impact there so far. So what I can tell you in Ann Arbor is that we pulled the data for January 2018 and then compared it to January 2017 and found that we had about 900 more days off due to illness this January so far compared to last year. We can't tell how many of them are flu-related or other related. We're able to parse out a little bit, but and we also have more students this year as well. So, but we think that there is some impact.
And what was the total number? So it was 900 more, and then I was trying to remember the 2017 number. I can probably look it up, but
the total number of absences. Oh gosh, it was something like 2,100 to 2,900.
Okay, so it's
I think.
up by like
and those are days off due to illness.
Okay.
Yeah.
So it's almost half again.
Yeah, although
I'll get that
I
for
need
the board.
to get that chart for you, and just don't quote me on that, anybody.
Okay. Well, I'll take that as a note to get that to the board, but
Okay.
it's a significant
Yes,
impact.
yes, yes. So that's the doom and gloom, but the good news is that there is still a lot that all of us can do to prevent the flu. And I have just a million graphics for this. This one happens to be from Hawaii, but all of the messages on this poster really hold true, and I'm going to walk us through them right now. First of all, it is not too late for a flu shot. We have at least 6 more weeks of flu season to go. If you can get a flu shot tomorrow, it takes 2 weeks for the antibodies to build up in your body, but then you will be somewhat protected for the rest of flu season. So it's absolutely not too late. Flu vaccination helps in a variety of ways. It can, of course, help you from getting sick, but it also can prevent the illness from getting severe enough that you have to go to the hospital, especially for people with chronic health conditions. It can make your illness milder if you do get the flu. And of course, you protect vulnerable people around you if you get the flu shot. And that includes babies, young children, adults over 65, and anyone who has a chronic medical condition. It's important to know what the flu is and what it isn't. And this is one of those public health things too, that we always hate it when people say stomach flu, because the stomach flu is not actually the flu. So the flu is something that happens pretty suddenly. You suddenly become sick. you have a fever, aches usually, chills. You might have a stuffy nose and a sore throat, you might not. But that chest respiratory part is really common, and often people have a headache. So it's pretty distinct from a cold, which can come upon gradually. You get that little scratchiness in your throat. You usually don't have a fever or chills. You might get a headache, but probably not related to the flu, and you might get chest discomfort. So knowing if you have the flu or you think you might is really important. If you do get sick, there's a lot of things that you can do for yourself and for others to protect them and protect yourself. And of course, this Cover Your Cough campaign has been going on for a long time. There used to be funny videos of people with all different kinds of sleeves, and they would like sneeze into their sleeve, and it's like public health humor that isn't funny to anybody else. But also, so covering your cough, making sure that any Kleenexes you use go into the trash, avoiding contact with people, wiping down surfaces, and of course, washing hands frequently. And I just have a harsh message for people. Go home and stay home. And stay home is the most important part, probably. And so the CDC recommends if you have a fever, wait until at least 24 hours has passed after the fever is gone, but you can't count if you've used ibuprofen or Tylenol. It has to be no medicine, fever is gone. There is Tamiflu available in the community. If you get to the doctor fast enough, within 48 hours, ask your doctor to prescribe you an antiviral, and you will possibly shorten the length of the illness. Of course, people who have the flu need to do the rest of the things on here. It's pretty common sense. It's resting, washing hands, going to the doctor. I'm not dispensing medical advice. I put that on the slide. And then Public Health sent me this great new poster that they have printed, and actually they're willing to send us some of these because they're our great partners. So across the whole school district, if everyone can just wash their hands at key points of the day, which is frequently, we can really help spread the, slow the spread of both flu and cold and all kinds of other things. So from the administration, I put keep calm and fight the flu here on purpose, because really, we're just calm. We're calm about it, right? We will be communicating with parents and staff, as Dr. Swift mentioned. Marios and GCA are going to be, well, not Marios himself, but GCA will be frequently cleaning those common touch surfaces that lots of hands are on every day. And we're also going to launch a hand washing campaign for students and staff.
And I would just add, Ms. Bacolor, that in the past, when we have a hot spot in the district, GCA's been good partners to go in and do an extra level of sanitation. We haven't had so much of that yet, but we're prepared when that occurs, and we do that overnight. GCA does that for us. So,
I've included some FAQs and resources. These are common questions.
And what we say to those who are not inclined to take shots, if you will.
If I can answer that question first. So it can be hard to convince someone to get a shot when they don't like getting shots. Sometimes I ask people, can you afford to take 2 weeks off and be home in bed this winter? And usually the answer is no. There's a ton of great scientific information available about the efficacy of the vaccine, which does vary from year to year. But I think the main message is that the best way to prevent flu and serious complications is to get the vaccine. It beats everything else that you can do.
Could you review with us the protocol of sick children? My child's getting sick in class, because I remember we've had a shortage of school nurses, and so I don't know if that little room at the principal's office, has a better. So what do we do for the sick child? Do we remove them from the classroom? And walk us through that, please.
Sure. if the school does have a nurse on site that day, that's the best because they can do things, taking the temperature, so forth. If a student suddenly becomes ill in the classroom for any reason, the student can be taken to the office, and often there is that little room with a little bed type thing. And then calling parents, and it depends on the symptom. If parents really need to come, I know with my kids, sometimes they had a mysterious stomach ache that just would go away after 20 minutes. So knowing the signs of flu is really important. It's the fever, chills, just suddenly becoming ill, feeling really crummy. Then the students can be removed to the little room. If there's a nurse present, great. If not, parents can be called.
Any other comments or questions, trustees? Thank you for this very optimistic, wonderful report, Ms. Bacolor.
Yeah, it's my favorite of all time.
It actually was very good, and I hope more of our community gets to see it.
Thank you very much, Ms. Bacolor. And I'm just so grateful because when we gave her this title, she wasn't seeking an additional title, but she has done the job very well. And I believe, trustees, this is only about the third time in that past couple of years that she's waved the flag. So she's not a health officer that just waves the flag every day. So I appreciate that, but it sounds like we need to pay attention. So thank you very much. And trustees, you do recall that we lost a child last year to the flu in the Ann Arbor Public Schools. So we're mindful of this.